All across America, people are confused about their Medicare coverage options. With new options every year and constantly changing regulations, there is no wonder why people are so confused. In fact, even if you have made your Medicare decision for this year, you still have one more chance to revisit and review your options. On today's program, we will try to clear up the confusion about these important health care options, as well as to help guide you in the direction that is right for you.
Thank you for joining us today. I'm your host, Liz McCallum. Welcome to the program. We're here to answer all of your Medicare questions. This is a very confusing time of year for many seniors. And I've got with me today Brian Philweber of Safeway Financial. Brian, thank you for joining us.
My pleasure, Liz.
Well, when Medicare started in 1965, it was a very simple plan. No add-ons, no frills, just basic Medicare coverage for seniors. Can you tell me what all this confusion is about?
Well, the government got more involved. In '97, they passed an act, and then in 2003, modified the act called the Modernization Act, which allowed Medicare to get into the managed care arena. PPOs, HMOs, a lot of products that were sold before you turned 65. So these seniors now have multiple choices, which brings on multiple confusion within the seniors deriving benefits, making decisions, cost, networks, doctors, and the like.
One of the most difficult things I understand for seniors is their ability to be able to compare one plan to the other, a apples-to-apples comparison. It seems very, very confusing.
Well, it is confused because you've got seniors on original Medicare, and there's millions and millions of over 30 million seniors, and then you've got over 9 million seniors who have taken advantage of the new program, the Medicare Advantage program, which are legally better benefits than original Medicare. So you've got that confusion both on, do I stay with original Medicare? Do I get a Part D program with the drug program? What's my out-of-pocket? This so-called Advantage program, what is it? How does it work? And then, of course, it's by county, the plans, all the carriers involved. So there's lots out there for these seniors.
And what is it that you do for seniors?
We try to make it simple. We spend more time with the senior because the CMS laws allow us now to do this telephonically, and we developed that technology with one of the largest carriers in this country, so therefore we can spend the time with the seniors, and that gives them the comfort of making that decision.
And the ability to look at one carrier versus another carrier versus another. I understand you don't represent the various carriers, you represent the senior, is that correct?
I represent the seniors. The senior is the most important aspect of this. These are seniors. These are folks who've gone through the Depression and the wars, and 65 to 70 years of their life, they're ready for an entitlement. We're supposed to give them that entitlement, but it comes with a lot of confusion, a lot of decisions by county, by state, by plan, different options. It's all confusing. We try to unconfuse the senior. That's our goal.
Brian, one of the things that I am unclear about is annual enrollment versus open enrollment. Can you tell me what is the difference?
And it can be confusing at times. The government has made a decision in their infinite wisdom that annual enrollment is from November 15th to December 31st. Every senior in America gets to make a decision every year. But open enrollment is different. Open enrollment is for those seniors from January 1st to March 31st. If they made a decision and they're uncomfortable with that decision, and there is a qualification, you have to have a Part D in your program, which is about 38 million Americans. They then can make another decision if they don't like the first decision. And that's what the government decided to do, to give the seniors an option if they didn't like what happened initially.
Okay, so just to reiterate, if you made a decision on your health care needs during the annual enrollment period, which ended December 31st, you have one more option to go back and revisit that decision by calling you and talking with a licensed agent and ensuring that these seniors have made the best possible choice for their individual needs, and they can make a change from now until March 31st. Is that right?
That's correct, Liz. And I really would hope that seniors just give us a call. We do a quick assessment. If it's the right decision from annual, then it's the right decision in open. If it's not, then they get better information. They make a better qualified decision. It's their health care. They're entitled to it. And all they've got to do is pick up the phone.
Well, Brian, this sounds too good to be true. So you're saying that seniors can call you. Are you just trying to get them on the phone to sell them something?
Absolutely not, Liz. This is what we're supposed to do. First of all, there's no cost to make a phone call to us. There's no cost to spend time with us. The bottom line is most of our seniors, they may find that there's zero cost for the benefits. And if you've got a Medicare supplement, you're spending a couple $100, you're looking to save some money right now with the economic times uncertainty, you can get the same or even more benefits with a Medicare Advantage plan at no cost.
Well, again, I'm just a little skeptical here. So what I hear you saying is that at no charge, a senior can pick up the phone right now, the number on our screen, or visit the website and get more information at no charge, possibly make a change, and all of that's free?
All of that has zero cost to the senior to make that call. And most of the plans, again, are zero premium plans, so they derive, by law, more benefits than original Medicare, and they've got the option of spending as much time as they want with our qualified, certified representatives 24 hours a day on the phone.
So how do you make your money?
Well, it's very simple, Liz. The taxpayers pay it. The taxpayers go to the government, they pay their taxes, the government provides the total income by county, by recipient, and it's actually done, so it goes to the carriers, and the carriers pay us. So it's really that simple. It doesn't cost the senior any money. No money at all.
And the way I understand it, you don't work for a specific provider. You work for all the providers.
To work for all the providers, whether the senior decides they want a Medicare supplement because they know there's a lot of out-of-pocket expenses on original Medicare, or they want a Medicare Advantage plan because the doctors in the network, they want to save some money, they don't travel. These are all decisions that go into that assessment where the senior is then comfortable because we can do it again over the phone telephonically by law provided by the government.
Well, it sounds like every situation is so unique that there's no wonder there's mass confusion out there.
Oh, there's so much confusion, but you know, we've had thousands and thousands of seniors who are satisfied with, again, our assessment, our tools on our website, and the ability to then relax and really just enjoy actually the process. And quite frankly, a lot of our seniors keep calling us back once a month, and they talk to a lot of our representatives a lot of the time.
What can a senior expect when they do pick up the phone and call you?
Well, we guarantee you'll get a live person on the phone 24 hours a day.
No automated systems?
You start with an automated. Within 5 to 10 seconds, you're on the phone with a licensed, certified representative that has screens available to look up all the decisions that you'd like to make and make a qualified decision.
Well, what kind of materials do they need to have prepared before they even pick up the phone? What do they need to do this?
Well, the most important thing they need, Liz, is their card. And of course, a lot of our seniors have their card. They carry with them all the time. It's part of their repertoire. They have their Medicare card, and that's all they need other than the decisions they want to make after they do the assessment.
Okay, well that sounds simple. So pick up the phone right now. It doesn't cost you anything. Dial that 800 number on your screen or visit the website to get more information. I have been on the internet looking at this, and there's so much information out there, it's overwhelming.
I too have been on the web many times for lots of things, and what we've tried to do is make it simple for the senior, 24 hours a day, 7 days a week, to go onto the site, relax, click on a few buttons, learn about the drug plans, learn about the questions that other seniors are asking, and once you're comfortable, pick up the phone and we'll just explain it to you, we'll guide you, and we'll give you the answers and the information that you need and you're entitled to.
What's the worst that can happen? Get more information. Dial that 800 number or visit the website today to make sure that you have made the best Medicare decision for you and your family. There's still time. Up until March 31st, you can go back and reassess and make sure that you're doing the right thing. Thank you so much.
Thank you, Liz.
To get information or review your Medicare coverage options, call toll-free 888-583-5337. That's 888-583-5337. Or log on to onemedicareinfo.com and use the plan finder to see your options. Now is the time to review and compare Medicare prescription drug plans with affordable premiums. You have one more chance between now and March 31st to review and change your Medicare coverage options for this year. Make sure that the plan you have is the best one for you. Call toll-free 888-583-5337. Call now.
Welcome back to the program. Earlier, we were talking with Brian Philweber of Safeway Financial, and he was here to clear up all of the confusion surrounding your Medicare options. Joining me now is Candace Pearl, also of Safeway Financial, and she's the customer care manager, someone that you may even get on the phone when you call. Candace, thank you for joining me.
Thanks for having me, Liz.
Tell me a little bit about what you do and what our seniors can expect when they call in.
Well, Liz, as you said, I'm the customer care manager, and I'm also in charge of ensuring that our agents are properly trained and educated on all of the benefit options and regulations that surround Medicare.
Oh my goodness, yes, and there are many ever-changing regulations surrounding Medicare, and that, I assume, leads to most of the confusion. And so what can a senior expect when they call in?
Well, Liz, they're going to speak with a highly knowledgeable agent who has the tools and technology to determine the best plan that meets their certain situation. So we actually have technology available to us that we can enter a person's zip code or county and state and bring up all the plans that are available to them. That gives us the opportunity to explain some of the benefits and really find a plan that's going to meet their needs.
You mean no matter where I live in the country, no matter what county I live in, you're going to have the information for all of that?
Absolutely, Liz. We have all of that information at our fingertips. So when you first call in, we're going to ask you, where you're located and what county you're located in. Then we're going to be able to use the technology to pull up all of the plans that are available in your area.
All of these choices vary from county to county, carrier to carrier, I understand.
That's correct, Liz. There may be a plan that's available in your neighboring county that's not available in your county. So it's very important to have the technology that we do to determine all the plans that are available in your particular area.
Who is it that's actually calling you on the phone?
Well, Liz, we have all types of people calling us. Obviously, we have seniors calling us. We have daughters, granddaughters, grandsons, uncles, aunts. We speak to a wide variety of people, people that have certain health conditions, people that are extremely healthy and just paying too much for their insurance, folks that are looking for certain benefits that their current plan doesn't provide. Certain medications may not be covered. So we speak to a wide variety of people.
So, Candace, you mean to tell me when a senior calls in, they're going to get a live person?
That's correct, Liz. We have licensed certified agents standing by 24 hours a day, 7 days a week to talk to a real person and to really evaluate their needs.
Yeah, because I've called some of these things sometimes and you get that automated call and...
None of that with us, Liz. It's always going to be a live agent there to assist you.
And so you speak to a variety of people to assess their individual unique needs and then find the plan over all the carriers out there that's best for them?
That's correct, Liz.
So from what I understand, timing can be critical with Medicare. I understand that open enrollment is from January 1st to March 31st. So is it important for seniors to be calling right now?
It sure is, Liz. The open enrollment period from January 1st to March 31st, you're allowed to make one change to your plan. So if you've made a decision during the annual election period, the November 15th to December 31st, and you're not sure if you made the right decision, it'd be an excellent time to pick up the phone and find out if the plan that you chose is the right plan, and you still have the opportunity to change one time during this enrollment period.
It just sounds too good to be true. And I know I said that earlier, but come on, what are you trying to sell?
Actually, Liz, we're not trying to sell them anything. We're just trying to determine if their current plan that they're on is meeting their expectations and their needs. And if it is, then we will tell them that. We have no problem hanging up the phone. It actually gives us a good feeling to know that the senior's taken care of, they have what they need, and so we're not trying to sell them anything.
No money changes hands during this call?
No, not at all. We never take any credit card information, no banking information. That's all done with the carrier. There's nothing, no payment information done over the phone. And in most instances, there's actually a plan available with a zero premium.
So there actually could possibly be saving money by calling you?
Absolutely.
Okay, well, did you hear that, folks? pick up the phone right now and call that number on your screen and get a hold of someone like Candace here who can really evaluate your unique individual needs and find the prescription plan or the health plan that is right for you at the best possible savings. Candace, thank you so much for joining us.
Thanks for having me.
To get information or review your Medicare coverage options, call toll-free 888-583-5337. That's 888-583-5337. Or log on to onemedicareinfo.com and use the plan finder to see your options. Now is the time to review and compare Medicare prescription drug plans with affordable premiums. You have one more chance between now and March 31st to review and change your Medicare coverage options for this year. Make sure that the plan you have is the best one for you. Call toll-free 888-583-5337. Call now.
Welcome back. We've decided to put Safeway Financial to the test by calling some of their customers, real folks who have used their service to get their stories about their experience. And joining me now is Rhonda from Georgia. Rhonda, thank you for joining us.
No problem.
Tell us, Rhonda, what your experience with Safeway Financial was like before you called them, your experience when you contacted them, and now where are you today?
Before I contacted Candace Pearl, I was literally just letting the system pick my medical coverage because it was all so confusing to me. I couldn't make heads or tails of it. So I was just letting them choose, and I was paying such high premiums and such high deductibles. It was literally taking half of what I have a month just to buy my medication, not to mention a doctor visit.
Wow. So you called Safeway, and what was that experience like on the telephone? Did you need a lot of information? Did it take a lot of time? Tell me about that.
It didn't take any more time than the questions that I asked. Candace was very specific about asking questions to find out exactly what I needed to make sure I wasn't getting anything I didn't need. And it was just so nice to have a human being on the other end of the line, someone that actually I felt like cared about what I actually needed instead of just some mind-numbing answer.
Where are you today? Tell me about your situation now.
Candace got me into a program that not only pays for my premiums, it also pays for my drug coverage. I was paying literally $600 a month for my drugs, which is half of what I have to live on. And that has gone from $600 a month now to less than $100 a month. And like I said, now I don't have to pay my premium because the coverage that she got me, a plan that she got me under, also pays for my premium.
Wait a minute, Rhonda. So you're telling me that by calling Safeway, you've saved over $500 a month?
Absolutely.
Now, and did this cost you anything?
Not a dime.
Well, you've heard it, folks, not a dime. So today you have more money in your pocket to spend on all of the other things. And how about your coverage? Is it the same coverage? Tell me, or is it less coverage? There's got to be something.
Oh, it's absolutely better coverage. I had a major surgery this year, and again, paid less than $50 for the whole thing. The coverage that she provided me with covered that well.
Well, you heard it, folks, these unbelievable stories and testimonials of people just like you who are saving money today just by calling Safeway Financial and allowing them to help you sort through all of the options available to choose from.
To get information or review your Medicare coverage options, call toll-free 888-583-5337. That's 888-583-5337. Or log on to onemedicareinfo.com and use the plan finder to see your options. Now is the time to review and compare Medicare prescription drug plans with affordable premiums. You have one more chance between now and March 31st to review and change your Medicare coverage options for this year. Make sure that the plan you have is the best one for you. Call toll-free 888-583-5337. Call now.
Welcome back to the show. All along, we have been doing our best to clear up the confusion surrounding your Medicare options. And joining me now is Steve Hadidis of Safeway Financial. He's the benefits specialist here to tell us what we don't know about Medicare.
Quite frankly, that's about everything. I'm being facetious, of course, but when the seniors do call in, they're very confused. And it's very simple to be confused because, first of all, Medicare was written by attorneys, and it's like looking at a large legal document. And trying to figure that out is virtually impossible. What our agents are able to do is to simplify these terms into very common, everyday language where it's amazing, Liz. 9 out of 10 seniors thank us at the end of the call because we've made it so easy for them.
Let me ask you another question. What about the low-income senior? Do you have any programs to help them?
Oh, boy, that's a great question, Liz. As a matter of fact, there's over 8 million seniors out there that don't even know that they qualify for some of these plans. As a matter of fact, last year, 2007, there were about 60% of Americans that qualified for other low-income subsidy plans were actually rejected, where this year they could get those be qualified in those exact same plans due to the changes in the economy this year.
Well, that's a lot of seniors who could take advantage of the cost savings available through these programs.
Absolutely. And through our research, we're able to do everything we can to help these seniors to bring their drug costs down. For example, on some of these plans, their drug costs could be pennies a day.
Pennies a day?
Literally, pennies a day. So again, these plans are available to the seniors. We assist the seniors in finding those plans. One
of the big concerns that seniors seem to have is sticking with their doctor of choice. Can they do that in these plans?
Yes. As a matter of fact, Liz, in a lot of cases, they certainly can. Seniors that have the Medigap or the supplement plans, they can pretty much go to any doctor they want. So if they've been seeing the same doctor for a number of years, of course they can continue to see that doctor. Some plans that they get into may have restrictions, and their doctor may not be in a network. However, other plans, like say a PPO or a private fee-for-service, yes, they can see their doctor that they've seen for years. The private fee-for-service plans are very good for those folks that live in a rural areas of the United States.
Very good. Well, tell me just briefly about some of the extra added benefits that a senior may find by making a change, such as hearing aid cost, eyeglasses, even gym memberships.
Absolutely. Isn't that amazing? I wish my insurance carrier would pay my gym membership. It's like everything else goes up every year. Liz, this is very true what you're saying. These Medicare Advantage plans, they must cover at least as what the minimum Medicare covers. A lot of them do have additional benefits, like you mentioned, hearing aids, eyeglasses. They'll actually contribute hundreds of dollars towards both eyeglasses and hearing aids. They'll pay for gym memberships, fitness memberships, which is totally amazing. A lot of these plans have dental services that are built right into the plans, along with prescription drug plans that are built right into the plans. So again, you need to call us. If you really, we'll do everything we can to see what's available for you in your area.
It doesn't cost you a thing to pick up the phone and call the number on your screen to find out if you can benefit by saving money from making a change to one of these options for Medicare. Thank you so much for being with us.
Well, thank you for having me, Liz. I've certainly enjoyed it.
To get information or review your Medicare coverage options, call toll-free 888-583-5337. That's 888-583-5337. Or log on to onemedicareinfo.com and use the plan finder to see your options. Now is the time to review and compare Medicare prescription drug plans with affordable premiums. You have one more chance between now and March 31st to review and change your Medicare coverage options for this year. Make sure that the plan you have is the best one for you. Call toll-free 888-583-5337. Call now.
And right now, I have Caroline from Illinois on the phone. How are you doing, Caroline?
Pretty good. I'm just waiting on an ice storm to come in.
Okay. Well, why don't you, Caroline, tell us your experience, say, before you contacted Safeway, and then where you are today.
Well, before I contacted Safeway, I had a lot of problems collecting from the insurance that we had and so forth. And then, of course, when my husband retired fully, we either had to go with a COBRA or find our own insurance.
Well, what is your situation today, Caroline? Do you have the same or similar benefits? Tell me about your prescription drug plan.
Everything has been fine. My husband's been in the hospital twice, and I've been in once since we started with you folks. We've gotten no bills, nothing. It's just been wonderful.
Carolyn, what would you tell the seniors who are watching from home, who are thinking about calling but they've not picked up the phone yet, to dial Safeway to find out about what options they have? What would you tell them?
I would tell them that I understand their confusion and their frustration and how they don't understand all the terms. And if they gave you people a phone call, everything would be explained to them perfectly clearly, and it would be a great relief for them.
But you were able to speak to the same customer care person over and over again, is that correct?
That's correct. Every time I call, he knows who I am, I know who he is, and it's just wonderful. It's like talking to an old friend.
I bet that gives you some peace of mind.
Yes.
Well, thank you so much, Carolyn, for joining us today and for being a part of the program and sharing your experience. And for you at home, if you have not picked up the phone to call, I want to strongly encourage you to do that, because as Carolyn said, at Safeway Financial, you are building a personal relationship. You will get the exact same representative every time you call in, and they will get to know you and your family and your needs and better serve you.
To get information or review your Medicare coverage options, call toll-free 888-583-5337. That's 888-583-5337. Or log on to onemedicareinfo.com and use the plan finder to see your options. Now is the time to review and compare Medicare prescription drug plans with affordable premiums. You have one more chance between now and March 31st to review and change your Medicare coverage options for this year. Make sure that the plan you have is the best one for you. Call toll-free 888-583-5337. Call now.
Thank you for watching today. Hopefully we've cleared up some of the confusion surrounding your Medicare options. And I want to thank my guest, Brian Philweber from Safeway Financial. Brian, thank you so much for allowing us to share this time with you and to talk to your customers. Boy, that was fun.
It was fun. It was nice to see our customers realize exactly what we promised, which is quality service and good analysis, good savings, and more importantly, customer service where they can call in and week out, or even year in, year out.
That's right, Brian. I just want to give you one more opportunity to talk to those seniors at home who may not yet have decided to pick up the phone and call and talk with you folks directly about how they can save money. So let's hear it. What else do you have to say, Brian?
Well, there's 38 million Americans, Liz, that have an opportunity one more time to take a look at their situation, whatever decisions they've made prior to January 1st. They have until March 31st. And whether they're on original Medicare, without a Part D, they need one. Of course, the expenses for drugs, if you're on a supplement, or even if you're on a Medicare Advantage plan, there's differences in those plans. Take a look one more time, and if we could provide that information is knowledge and power to be able to give you the quality health care you're entitled to on behalf of the taxpayers of this country.
Well, there you have it, folks. Again, I hope we've helped you to clear up some of the confusion surrounding your Medicare options. I want to strongly encourage you to pick up the phone right now and explore all of the available options to save you money with Safeway Financial. Again, at no charge to you. Please, right now, call that 800 number on the bottom of your screen or visit their website and look at all your choices to save money. Thank you for watching.